Hello and welcome to today's session. This session is an information session and is going to be about testicular cancer. Testicular cancer is very topical this month as April is Testicular Cancer Awareness Month. So I thought I'd just give you a quick run through of the signs and symptoms to be aware of with regard to testicular cancer. So the most important thing to know is that testicular cancer is a rare cancer. It's mainly affects people, the male population who are younger, so sort of 15-year-olds to men into their 40s. So they're the main population that would get testicular cancer, but obviously people on either side of this could get testicular cancer as well, but the majority would be between those ages. Testicular cancer does have a few risk factors that make you more likely to get testicular cancer, and that can be having an undescended testis at birth. It could be that you've got a family history, so a father that's had testicular cancer, or it could be that you've had testicular cancer in the past. So they're the three things that can make your chance of getting testicular cancer more likely, but it doesn't mean to say that you're definitely going to get testicular cancer if you have one of those three risk factors. But also, if you haven't got those factors, it doesn't mean that you wouldn't get testicular cancer either. It can just come out of the blue and it can just be one of those things that happens, and it's certainly nothing that you've done to cause or create it. So I think that's one of the things that people need to be aware of, that there shouldn't be any embarrassment associated with asking your GP to see you if you've got a lump or a swelling, because they will have, number one, seen everything so many times and been asked so many questions that you'd never have anticipated they would have been asked. And really the embarrassment often lies with the person, the patient that's coming through the door. And the GP should be able to reduce some of the anxiety that that person's feeling, as it's a huge thing to have to go to your GP at a young age and discuss a problem that you have with your testis. The main signs and symptoms that people have when they have testicular cancer are that they would present to their GP with a swelling in the testis, pain or discomfort. So they're the main things that people present with. As I've said, awareness around testicular cancer is really important, because the more people that are aware and the less of a stigma and taboo there is about discussing testicular cancer, the more likely somebody will go to see their GP more quickly and get a diagnosis. With testicular specifically, the earlier you get a cancer diagnosis, the less treatment you hopefully would need, and the easier it is to treat. Testicular cancer is often very treatable and very curable. So I think that's the real take-home message, is if you are concerned, do see your GP, speak to your GP about it and get the reassurance that you need. The GP will have seen, as I said, all of these things before, so you shouldn't feel embarrassed about having to discuss it with them. So I hope you've learned something from that, from this session, and that you feel a bit more empowered about speaking to your GP if you've got any concerns. I'll see you soon.